have aortic valve disease. Over time, your aortic valve has become calcified or leaky, making it hard for the blood to be pumped out of your heart. Causes of aortic valve disease include being born with a bicuspid aortic valve, which is 2 leaflets instead of 3, calcium buildup on the valve making it hard and stiff, or rheumatic fever. You have met with your doctors and have had numerous tests that indicate you need your valve replaced. You've been told you need to have a transcatheter aortic valve implantation, otherwise known as TAVI. Throughout this video, we will explain what a TAVI procedure is, why you may need one, what to expect before, during, and after the procedure. We plan to give you the information you will need to prepare you and your family for the procedure and care at Kelowna General Hospital. You may also see TAVI being referred to as TAVR. For the purpose of this video, we will refer to it only as a TAVI as we are implanting a new valve. The aortic valve is one of 4 valves in your heart. These valves keep the blood flowing in the right direction. If your aortic valve is not working properly because it is too tight or stiff, this is called aortic stenosis. If the valve is too leaky, this is called aortic regurgitation. When the aortic valve gets stiff or leaky, the heart has more and more trouble pumping through the valve opening. When this happens, you may experience shortness of breath, chest pain or discomfort, feeling lightheaded and/or passing out. Treatment options. For people with aortic valve problems, the treatment options are medication, open heart surgery, or TAVI. There are many reasons for selecting various treatment options. Your healthcare team will arrange a series of tests to determine the best treatment options for you. Before your TAVI. Before you are considered to be able to have a TAVI procedure, your medical provider will have ordered several tests, including an electrocardiogram, otherwise known as an ECG, which is a tracing of the electrical activity of your heart, an echocardiogram, which is an ultrasound of your heart, a CT scan, or CT angiogram, looks at the structure of your heart and vessels. This is different from a coronary angiogram. Both these tests will be completed at Kelowna General Hospital prior to you being accepted for a TAVI procedure. A coronary angiogram, an injection into the coronary arteries, which will determine if you have blockages in the vessels that carry blood to your heart. This procedure is done at Kelowna General Hospital and requires the medical team to feed a catheter up your radial artery in your wrist or your femoral artery in your groin to look at the arteries that feed your heart muscle. A team of healthcare providers, after all your tests, will review information. The TAVI clinic will contact you with the outcome of the team's decision. At that time, you will be placed on a wait list. Our nursing staff will provide you guidance as to your wait time. Once it has been decided a TAVI would be the appropriate procedure for you, the TAVI clinic will give you a date and time for your appointment. There are a few things for you to arrange before the procedure. Make sure you have an able support person to help care for you following your discharge for the next 72 hours. Some patients may be suitable for discharge on the same day as a TAVI procedure. Your TAVI team will discuss this option with you to decide if this is a possibility. Most people should plan to stay at KGH for 1 night. Discharge is typically arranged for the following morning. Occasionally, we need to monitor patients for longer. Prior to your appointment, the TAVI clinic will tell you what to bring for your overnight stay at the hospital. You will also receive fasting instructions and discuss which medications to take or hold. We will confirm any outstanding blood work to be completed before the procedure. Please note you will not be allowed to drive for 2 weeks after your TAVI. Also note this will be a long day. Please bring a book, cell phone, or tablet if you like. On the day of your procedure, you will arrive to the cardiac cath lab. During the procedure, you will receive medications so you will be sleepy through the procedure and be kept comfortable. Your procedure will be performed by a specialized TAVI team. Using the specialized ultrasound and X-ray, the doctor will guide the catheter with the valve into your heart. The TAVI procedure allows the aortic valve to be implanted using a long, narrow tube called a catheter via the large blood vessel in your groin or your femoral artery. Once it is correctly positioned, the new valve will be implanted within your existing one. The catheter is then removed and the new valve begins to work immediately. From the procedure room, you will be cared for and monitored in the cardiac cath recovery bay. You will spend the next few hours recovering flat on your back and receiving further education. The nurses will be checking your groin sites and feet to assess for bleeding and circulation. Mobilization will be slowly introduced as you progress through your recovery. You will be transferred to a cardiac unit until discharge. Patients with valve replacements may have an increased risk of developing infection of the heart and surrounding tissue called endocarditis. Check with your doctor as you will require antibiotic before some surgical procedures or dental visits in the future. There are 3 main complications of the procedure you should be aware of. Bleeding. If bleeding happens after your discharge, your support person will need to apply pressure to the area. A demonstration will be completed with your support person prior to discharge. Slow heart rate. A TAVI procedure can disrupt the natural pacemaker of the heart. Some patients require a permanent pacemaker after their TAVI. If your team thinks you need a pacemaker, this will be done while you are in the hospital. Occasionally, people have a very slow heart rate after their discharge home. If you experience significant lightheadedness or feel like you could pass out, it may be because of a slow heart rate. If this happens, you need to seek emergency medical attention. High blood pressure. High blood pressure after TAVI is common. We will monitor your blood pressure while in the hospital. You may be asked to monitor your blood pressure at home, and we may need to change your medications. Cardiac rehabilitation may be recommended after your procedure. If this is something you are interested in, please let your nurse know so a referral can be made. There are also options for in-person or virtual cardiac rehab programs.